Dr. Sajid here. We were talking about milk earlier in one of our videos, and I had mentioned that milk is a very important form of nutrition, of energy, and it is very essential for the growth of infants and children. However, milk can cause a problem, like we discussed the last time. It can cause allergies, and that can cause a problem. But today we are going to talk about another problem with milk, which is called lactose intolerance. Now, lactose, as you can imagine, is a sugar, and milk contains carbohydrates, it contains proteins, and it contains fats. We spoke about proteins last time. Today it is the turn of the sugar. So the sugar, milk sugar as it is called, lactose, can cause a problem in some children. So why does it occur? Well, let me explain. The lactose sugar that is taken in with the milk gets into the intestines, and in the intestines there is an enzyme which is called lactase, and that lactase enzyme breaks this lactose or sugar down into simpler sugars, and then it is absorbed. Now, if a family, a child or a grown-up for that matter, or an infant does not have this enzyme which is lactase, then that lactose passes through undigested and it produces discomfort, and this is what is lactose intolerance. So how does it occur? If there has been an inflammation or infection of the intestine, or the intestine is affected by a disease that was present now or has been present for a while, then the intestine may be so damaged that this particular enzyme disappears from the intestine. Another reason for, and so the commonest reason would be diarrhea in children. So if a child has a lot of diarrhea, he may become what is called temporarily lactose intolerant. The other reason is a baby may be born without this enzyme in a particular family, or in some families a baby is born without it. So every time he takes milk, he develops what are called symptoms. Irritability, pain in the abdomen, has a gassy feeling, a bloated feeling. If it's an older child, he will explain to you that he gets bloated, may get nausea, may also get vomiting. And the child, same food that is supposed to make him gain weight, the child does not thrive, does not gain weight, and becomes uncomfortable. So the doctor will examine the child after having taken the history and come to the conclusion that this is a possibility. If that happens, then invariably one or two tests are done, and those tests have to be done on the stool, mostly on the stool of the baby, and that will tell us whether this baby has some problem digesting sugars, and we have ways of knowing. Occasionally a blood test may be necessary. Most of the time it isn't. So the diagnosis is made by talking to the parents, looking at the child, and some very minor tests. So once this diagnosis is made, what do you do? So then this baby cannot have the regular milk, which has the regular lactose sugar. So has to have special formula, and that special formula will not contain this particular lactose, and these are available and can be given to the baby in place of the regular milk. So that is one solution, and sometimes when that is not possible, or it doesn't suit the baby or the child, then there are enzyme tablets, as we call them. So you have heard of these tablets, and for infants you also have what are called drops of the same enzyme. So what the doctor will explain to you, that you take the milk and you drop these drops into the milk and in a prescribed ratio, and then you keep it in the fridge for 24 hours, and then you give this milk to the baby. When this milk is given to the baby with this enzyme, then it has taken care of the lactose. It's broken down because this tablet or the drops contains lactase, and therefore the baby can digest. No discomfort, the baby can thrive, grow, start gaining weight, and it's a different child. So milk, yes, very useful, but in some instances it can cause difficulties. You just have to find out if your baby or your child has this problem, and it can be taken care of very, very easily. We'll come back again with other aspects of milk in the coming videos.